Hello everyone, welcome to Pediatrics by Dr. Anand. Please let me know is my voice coming to everyone. Thank you so much. Good evening and regards. My name is Dr. Anand. Today is a beautiful day to share some immense amount of knowledge. My name is Dr. Anand. I hope my voice is audible to everyone. Yes, I think it is coming. Yeah, it is coming. Let's start this class. Okay, please let me know if my voice is coming to everyone. Thank you so much. Today is a beautiful day to share some immense amount of knowledge. My name is Dr. Anand. Let's start this class and let's enrich, let's learn some good stuff. So yes, before starting any segment, we always have a quote, and the quote for today is: nothing is a coincidence. Nothing is a coincidence. Everything you are experiencing is meant to happen exactly how it's happening. Nothing is coincidence. We all are working so hard. You are working so wonderful. Everyone will get a rank. You just have to believe in yourself, because nothing is a coincidence. Everything you are experiencing is meant to happen exactly how it's happening. So yes, हम होंगे कामयाब. Good evening. Yes, good evening Goldie, good evening Nirmala, all the beautiful people. So many are there right now live. सबके नाम कैसे लूँ मैं? Okay, so we have Prabha, Shubham, Prince, Sunidhi, Sangeeta, Vijay Maholia, Varisha Khan, Drishti Barad, Goldie Singh, Sia, Nirmala Musharraf Khan, Desi Struggler, and Sunidhi Chaudhary, Priyanka Patra, Shabnam Era, and Anand Singh. Birth length doubles by what age? Let's make this class extremely meaningful. Let's try to answer. Put everything aside. Next 30 minutes you are with me, and let's get a rank together. So we all know that weight doubles by 5 months and height doubles by 4 years. Weight doubles by 5 months and height or length doubles by 4 years. That is the right answer. When does the parachute reflex disappear? Can you please answer in the comment section? We always have done that important point, that tell me one neonatal reflex which once appears never disappears. So parachute reflex is one reflex which never disappears. If I put the baby, very importantly please remember, if I suspend the baby down, अगर बच्चे को हल्का सा नीचे करे, बच्चे को हल्का सा नीचे करेंगे तो बच्चा अपने हाथ ऐसे करेगा. If I put the baby down, the baby will put his hand like this. So that's very importantly known as kind of a parachute reflex, which comes basically, which appears, by 10 months, and once it appears, it never disappears. Which assessment finding in a neonate should the nurse recognize as a potential indicator of coarctation of aorta? Yes, beautiful question. So we are here regarding the coarctation of aorta. So what all do you know regarding the coarctation of aorta? One second, let me put the question properly. Yes. Okay, one second. Yes, coarctation of aorta. So yes, we all know that in a case of coarctation of aorta, like if this is the aorta, this is the coarctation, or nothing but this is the aortic obstruction. So if there is obstruction in the aorta, the blood basically is coming here, but very less blood is going down. Yes or no? If there is a coarctation of aorta, this is the aorta and this is the coarctation, or this is the aortic obstruction, then the blood which is coming there not able to go down to the thoracic and abdominal aorta. So very less blood is going down to the thoracic and abdominal aorta. That is why you have absent pulses in the legs, in the lower limbs, and you have bounding pulses in the arms. That is why option number D becomes the best answer for this question. Next question please. Which of the following pair of gross motor developmental milestones and the age at which the child generally develops is wrongly matched? Which one is a wrongly matched? So skipping, yes, a baby skip by 5 years, that's true. A baby can do hop by 4 years, that's very true. And very importantly, he can ride a tricycle by 3 years. But walk upstairs and downstairs 2 feet at one step. So in general, just remember we have 2 year, 3 year and 4 year. 2 साल का बच्चा कैसे चलता है सीढ़ियाँ? 2 साल का बच्चा पहले एक पैर रखेगा, फिर दूसरा पैर रखेगा, फिर एक पैर रखेगा, फिर दूसरा पैर रखेगा. He will put 2 feet at one step. A 2-year-old child, he will put 2 feet at one step. Alternate steps, if I talk about, very importantly, alternate steps, when does the baby does that? Alternate steps, please remember, the baby does by 3 years. And when can a baby come downstairs? A baby can come downstairs, please remember, a baby can come downstairs by 4 years. A baby can come downstairs by 4 years. So that is the best answer. Exactly. B is the best answer for this question. A 20-month-old child was diagnosed with severe acute malnutrition and was started on treatment. So, when can the child's treatment be considered complete? When will we say his treatment is definitely complete? So, when we'll say his treatment will be completed? So, there is no evidence of edema for at least 2 weeks. There is no edema for at least 4 weeks. There is no edema for at least 4 weeks is a wrong point. Yes, there should not be any edema by 10th day or by at least 2 weeks. There should not be any edema because that kwashiorkor baby is there, that fatty baby is there. So fatty baby is kwashiorkor. Once you start treating him, the edema should slowly come down, and by 2 weeks that edema should totally come down. Weight for height reaches -2 standard deviation or higher. So answer is the D for this question, means if criteria 1 is correct or either of 3 or 4 is met. Okay, means weight for height reaches -2 standard deviation or higher, and MUAC is more than 12.5 centimeter. See, we all know that what is severe acute malnutrition. Severe acute malnutrition is weight for height less than -3 standard deviation, right? If the patient is coming in 3 standard deviation to -2 standard deviation, that is a discharge criteria, that is a good to go. Okay, that is why weight for length reaches -2 standard deviation. ठीक है, बच्चे की हम छुट्टी कर सकते हैं इसमें, we can discharge the baby. Please remember that. There is no edema for at least 4 weeks. No. Kwashiorkor baby, once you admit, by 10 days I am expecting, or maximum by 2 weeks I am expecting that every edema will be down, edema will go. Okay, next question. A 4-year-old child has been diagnosed with iron deficiency anemia and has just started on oral iron supplementation. Pediatrician advised the parents certain changes and observation can be expected during the initial days of treatment. On the third day after starting the oral iron therapy, which of the following is most likely to be seen? So very importantly, irritability and all that within 1 day after starting the iron therapy, within 1 day, what is the one change you're expecting? The irritability will come down. But by the third day, you are expecting the reticulocyte count to go to become better. These are the two very regular questions. बच्चे को आयरन देते ही पहले तो उसका चिड़चिड़ापन ठीक हो जाएगा, और तीसरे दिन जो है उसका रेटिकुलोसाइट काउंट बढ़ने लगेगा. Once you start the iron therapy, first thing is the irritability which will go down, and then the retic count will improve. A 2-year-old girl was brought to the pediatrician with complaints of repeated hand wringing movement. Hand wringing, where do you see hand wringing movement? And the patient has developmental regression. Whatever she was achieving, she now is not achieving. Like there is a developmental regression. जो गर्दन संभाल पाती थी, चल पाती थी, अब तो वो भी नहीं कर पाती है. Developmental regression, hand wringing movement. We're talking about Rett syndrome, very commonly asked in exam questions. 4-week-old male infant presents with projectile vomiting for the past week. Okay, the parent reported reduced wet diapers, thirst and irritability. This patient has vomiting and thirst. He's very thirsty, He has dry mucous membrane, and CFT is also kind of a deranged, but thirsty. If the child is thirsty, that is known as some dehydration. So some dehydration becomes the best answer for this question, where we give ORS at the rate of 75 ml per kg. Very regular question. My HOD used to say common things are common and rare things are rare. It's a very common question they ask in exam. So next question. 1-day-old neonate came with bilious vomiting and abdominal distension. Vomiting, abdominal distension, some surgical problem. And this is the X-ray. If you look at the X-ray very importantly, carefully, what are you seeing? 1 bubble, 2 bubble, 3 bubble. So this X-ray very importantly is showing you is a triple bubble sign, which is of course seen in a case of jejunal atresia. Single bubble, double bubble, triple bubble. Single bubble pyloric stenosis, double bubble duodenal atresia, and triple bubble is jejunal atresia. So jejunal atresia is the best answer. 4-month-old infant came with 5-week history of scaly lesions on the face, trunk and limbs. 4-month-old baby, 5 weeks history of lesions over the face, trunk and limbs. Child is very irritable, dehydration and edema. So number 1 highlighter is the edema. Number 2 highlighter, some kind of what you called rashes are there, and the patient has hypoalbuminemia. So what do you think? Is it marasmus? It is flaky paint dermatosis, flag sign, acrodermatitis enteropathica. Acrodermatitis enteropathica is because of deficiency of zinc, for which the patient will come with diarrhea, and the patient will have not just rashes over here over the face or perianal, perivaginal. So this is not acrodermatitis enteropathica. This flag sign, no, flag sign is the sign, hair wala sign, that hair dark and bright colors of the hair follicle, that is flag sign. Marasmus and flaky paint dermatosis. So yes, the best answer, this scaly lesions, hyperpigmented patches, these are nothing but flaky paint dermatosis, which is seen in a case of kwashiorkor, and kwashiorkor patient has edema has kwashiorkor patient, that you should know. Has everyone understood this much? Yes or yes? Please let me know. Yes. Hi Karan, Komal. Yeah, hi Nikhil Kumar, Nirmala Shah, Chiru, Shrestha Singha Roy, Mona Lisa, and Neha Koparde. Okay, great. लेट्स कंटिन्यू नाउ. अगेन अ वेरी हैप्पी सॉन्ग. साथ में गाना गाते हैं सारे के सारे. जो गाना नहीं गाएगा उसका क्लियर नहीं होगा. कौन सा गाना गाना है? हम होंगे कामयाब, हम होंगे कामयाब, हम होंगे कामयाब एक दिन. हो मन में है विश्वास, पूरा है विश्वास, हम होंगे कामयाब एक दिन. So weak minds surrender strong. Weak mind surrender strong minds. Very importantly, so this one line they have written: weak mind surrender, and strong mind rewrite the destiny. Weak minds surrender, and strong minds rewrite the destiny. So this is the time for you to rewrite your destiny and prove it that you have in you and it is possible. Yes. What is the weight for which KMC is generally recommended? What is the weight for which kangaroo mother care is generally recommended? So kangaroo mother care, the minimum weight for kangaroo mother care, I can say it is 1.8 kg, and you can go till 2.5 kg. The minimum weight is to 1.8 kg. The maximum weight जहाँ हम kangaroo mother care we can do is 2.5 kg. So here 1.8 is not there, so automatically the best answer for this question becomes the 2 kg. MCQ, kangaroo mother care, where the baby and the mother are like, baby is there with the mother 24/7. So 1800 ग्राम पे चालू करते हैं, जब बच्चा 2.5 किलो का हो जाता है तो बंद कर देते हैं. A child with nephrotic syndrome is receiving corticosteroid therapy. What should the nurse closely monitor? So we all know the patient of nephrotic syndrome, they have anasarca, they have generalized body swelling. Yes or no? Once they have generalized body swelling, and the patient usually have massive proteinuria, the patient usually have a massive proteinuria. So massive proteinuria, anasarca, so automatically B becomes the best answer, where I'll be checking the proteinuria, I'll be doing the heat coagulation test, that is why B becomes the best answer. Vitamin D and calcium deficiency, no. If this was a case of rickets, then I would have checked for vitamin D. Signs of dehydration, no. If this was a case of diarrhea, I would have done that. Next question. How many diseases are prevented by vaccines included in national immunization schedule? Yes, that's a very logical, very straightforward question. Thank you so much, Ashu. That's very sweet of you. Anjali, thank you. God has been kind. But I'll be speaking in English and Hindi language. बस सिंपल सा क्वेश्चन है कि यार इम्यूनाइजेशन शेड्यूल में कितनी बीमारियों से बचाव किया जाता है? इम्यूनाइजेशन शेड्यूल में हम 12 बीमारियों से बचाते हैं. इन अ केस ऑफ नेशनल इम्यूनाइजेशन शेड्यूल, द डिजीजेस बेसिकली विच आर प्रिवेंटेड, दे आर वेरी इंपॉर्टेंटली 12, एज इन डिप्थीरिया, pertussis, tetanus, tuberculosis, like that. So 12 diseases we are preventing in this schedule. Which type of rash is characteristically seen in the measles? So we all know that measles, the rash will start behind the ear. Very importantly, behind the ear rash will start, then it will go to the face, and then it will go to the body. So this is important: behind the face, behind the ear, then the face, and then the body. So very importantly, a case of measles. So this measles, very importantly, it is a maculopapular rash. Maculo means change in color, papular means elevation rash. Why it is not vesicular rash? Vesicle means pani wale dane. Water filled rash. Water filled rash or kind of a vesicular rash you see in a case of chickenpox. Okay, that you should know. Next question, please. What type of rash is typically seen in chickenpox? Just now we spoke about it. Chickenpox, very importantly, chickenpox also have rashes on the face, on the body. They are very much on the body, that is known as centripetal rash. जो रैशेस पेट की तरफ ज़्यादा रहते हैं वो होते हैं सेंट्रीपिटल, और जो फार एरियाज हाथों पाँव में होते हैं दैट इज सेंट्रीफ्यूगल. सो दिस इज सेंट्रीपिटल रैश इन अ केस ऑफ चिकन पॉक्स विच इज कंसंट्रेटेड इन द सेंटर. Education is the most powerful weapon which you can use to change the world. Educational is the most powerful weapon, guys, which you can use टू चेंज द वर्ल्ड. ज़िंदगी भगवान की एक बहुत महंगी गिफ्ट है. रो पिट के भी इस्तेमाल किया जा सकता है और बहुत खूबसूरती से भी इस्तेमाल किया जा सकता है. बस ये है कि खुश रहें. वो कहते हैं ना कि ज़िंदगी का बस एक अंदाज़ रखें. ज़िंदगी का बस एक अंदाज़ रखें. जो तुम्हें ना समझे उसे नज़रअंदाज रखें. A child is diagnosed with pyloric stenosis and is experiencing projectile vomiting. What acid-base imbalance are you expecting? So we all know in a case of pyloric stenosis, this is the stomach and this part is pylorus. So pyloric stenosis, whatever the mother will feed her child, the baby will vomit. So the baby vomit because there is a pyloric stenosis. ये रुकावट है ना, बंद है यहाँ पे. So once the baby vomit, all the acid goes out and the patient will have metabolic alkalosis. Metabolic alkalosis, and very important exam question. What is the name of the surgery for pyloric stenosis? It is Ramstead pyloromyotomy. So Ramstead pyloromyotomy, very importantly, yes Priya, that is the name of the surgery for CHPS. Which of the following is a common complication of measles? The most common complication of measles is otitis media. Most common cause of death in measles is pneumonia, and the late complication we can expect is subacute sclerosing panencephalitis, that you should know. The given growth chart shows child height plotted against the age and the measurements falls below -2. What does this indicate? Is it wasting, stunting, underweight or obesity? If you look at the chart very carefully, this side we have the height of the baby, this side we have the age of the baby. So if I say decrease height for age, is this acute malnutrition or chronic malnutrition? So जब height कम होती है तो उसको हम stunting कहते हैं, और stunting आता है chronic malnutrition में. When the height goes down, that is known as stunting, and stunting comes under chronic malnutrition. So stunting automatically becomes the best answer. So next important point we have it. The given image shows a newborn with severe limb malformation. The newborn has severe limb malformation. I'll show you the picture. So this one, the baby, बच्चे के हाथ पाँव नहीं बने हैं. So this is nothing but known as phocomelia, where the limbs are not formed. Any idea the mother would have taken which drug during pregnancy? If the mother has taken thalidomide during pregnancy, the baby can land up into this problem known as phocomelia. Yes, Anjali, Rajkumari, Karan, Neha Kapoor, Falak, Neha Kumari, Gautam, Swarna, Harshita, Dhakad Girl Vlogs. Yes, exactly. You are very, very right. Again, let's have a quick song. गाना गाते हैं आराम से. सबको हो रही है, हाँ सबको हो रही है खबर, चुप के दो दिल मिल रहे हैं मगर चुप के. So yes, we have a lot of vitamins. Vitamin B1 is thiamine and vitamin B2 is riboflavin. Vitamin B1 is thiamine and vitamin B2 is riboflavin. Yes, Sakshi. And vitamin B3 is niacin. Niacin deficiency causes a problem known as pellagra. Niacin deficiency that causes the problem known as pellagra, where the patient have 4D, that is diarrhea, dementia, dermatitis and death. Which instrument is shown in the picture given below? Yes, this is a very nice instrument. Basically, I'll show you a bigger picture of this instrument. This is this instrument. So to remove the urinary bladder clots, to basically remove the clots which are there in the urinary bladder. So to remove the clots, we have this instrument. This is known as evacuator. We are evacuating the clots, so it's Elix evacuator. Elix evacuator is the name of the instrument, basically to remove the clots, to for the evacuation of bladder clots in after TURP. After transurethral resection of prostate, to evacuate the bladder clots, we are using this Elix evacuator. Which of the following is defined as compulsive urge to steal items? Very common question. Compulsive urge, yes, Radhe Radhe, compulsive urge to steal item is known as kleptomaniac. So kleptomania मतलब चम्मच चुराने की बीमारी, कहीं पर ऐसा कुछ तो exactly. So this is kleptomania that you should know. What is trichotillomania? From trichotillomania is pulling your own hair. If you pull your own hair, that after seeing the NORCET result, that is known as trichotillomania. Remove is stealing the items, known as kleptomania, that you should know. Pyromania is the urge to set fire. आग लगाने की इच्छा, दूसरे के दिल में, दूसरे के जीवन में और अपने आसपास भी. तो ये फीलिंग ऑफ पुटिंग समथिंग ऑन फायर मेक्स मी फील सो गुड, नोन एज पायरोमीनिया. Satyriasis, what is satyriasis? Uncontrollable sexual desire in men. Uncontrollable sexual desire in men, that is known as what you call satyriasis, that you should know. ठीक है? Is my voice to coming to everyone? Is the voice, sound, audio, video coming? Please let me know quickly. Put a thumbs up quickly if it is coming. Thank you so much. What is erotomania? Erotomania, remember very importantly, erotomania means like my favorite is Aishwarya Rai, and Aishwarya Rai is giving a TV talk show, and I feel that in the TV interview she's talking about me. That belief itself is known as erotomania, a belief that someone of higher social status is in love with me. That is known as erotomania. Aishwarya Rai is giving a TV interview, and in TV interview, whatever she's talking, I feel she's talking about me only. Known as erotomania. Remember that, okay? That you should know. Next, we have is something known as hypochondriasis. One option was there, hypochondriasis, persistent worry about having a serious illness. As in, if I'm having a cough, I'll think of cancer. If I have breathlessness, I'll think of kidney problem. So, persistent excessive worry about us having a serious illness is known as hypochondriasis. I'll repeat again. So erotomania is this belief of that someone of higher social status like you, and if this what you call hypochondriasis is illness, anxiety disorder, and that you should know. That's it. Has everyone understood this much? Yes or yes? Please let me know. Last 10 minutes and this class is over. Thank you so much. Okay. Yes. Again, a quick 10 seconds break. Take a deep inspiration. Hold your breath. 1 and 2. Deep expiration. Life will give a very different meaning altogether. In your main exam, just before opening the paper, you'll be so anxious and so crazy. Just deep inspiration. Hold your breath. 1 and 2, and slow expiration. What we learn with pleasure, we never forget. So life is a one time offer, use it well. रो पिट के भी पढ़ाई किया जा सकता है, लेकिन खुश रह के भी पढ़ाई किया जा सकता है. I can be very cranky while studying, I can be chilled out while studying. Yes. Yes, Ashu. Which of the following is not included in the criteria for severe acute malnutrition? So we all know that which is not included. So severe acute malnutrition is weight for height less than -3 standard deviation, mid upper arm circumference less than 11.5 centimeter, and edema. So height for age, which is known as stunting, it is a chronic malnutrition. It is not a criteria of acute malnutrition. Yes, Warner, life is beautiful, life is amazing. जिंदगी भगवान की बहुत महंगी गिफ्ट है, मौज लेके जिए. Which of the following defect is shown in the image? This baby brain is not there. Okay, this baby brain is not there. Now the brain problem, that is known as anencephaly. Anencephaly means head, and NN means nothing is there. So this neural tube defect, mother mother would not have taken which drug during pregnancy? If the mother has not taken folic acid during pregnancy, the baby might have landed up into this problem. So mother should be taking folic acid during pregnancy. Next question, identify the primary use of the feeder given in the image below. So this is the feeder. This is a very strange feeder. If I show you one more picture, this one, very important, as it's written over here, it's a cleft palate bottle. Babies who are suffering from cleft lip and cleft palate, for those babies we use this bottle known as pigeon cleft palate bottle. So this, very importantly, we all know it is used in a case of, you know, feeding infants with cleft lip and repair. That is what we use this bottle. Okay, done. Next question, please. A full-term newborn came with skin lesions shown in the image given below. This baby, newborn baby, is having some skin lesions. Okay, if I have another picture on this, very importantly, they are erythematous. They are little reddish. If I show this picture, this one, this baby is having some skin lesions. They all are very reddish. So one very common skin lesion in the baby, this is known as erythema toxicum. So this is known as erythema toxicum. Looks toxicum, but it is a benign condition. It's a very conservative management, normal condition in a newborn. This reddish patch, erythema, that is erythema toxicum. Which event is observed on February 10th for children in some regions? Yes, February 10th. What do you celebrate? National Deworming Day. Please remember, National Deworming Day we celebrate on what you called 7th of 10th of February. World Health Day we have on 7th of April. World Health Day 7th of April. International Literacy Day 8th September, and International Children's Day 1st June. So we all know, see, 14th November we all know we celebrate Children's Day. 14th November we celebrate Children's Day, but International Children's Day we celebrate on, very importantly, that is 1st of June. So National Deworming Day. So tell your brain, tell yourself, you have amazing memory. Tell yourself, I will remember this forever. What will you remember? Because that the National Deworming Day comes on 10th February, World Health Day 7th April, International Literacy Day 8th September, Children's Day 14th November, but International Children's Day comes on 1st June. 2-year-old child came to the clinic with leg deformity shown below. So what do you think this leg deformity? So we all know that it is vitamin D deficiency. The baby has widening of wrist, frontal bossing. Very straightforward question. This is the rickets case. In addition to classical symptoms of Kawasaki such as fever, conjunctival infection and a rash, which of the following is an uncommon but potential complication? So Kawasaki, we all know Kawasaki is a medium vessel vasculitis. In Kawasaki, it's a medium vessel is involved. Which is a medium vessel? Coronary artery. Coronary artery is a median vessel, and that is why the patient can get a coronary heart attack, coronary aneurysm, MI. Please remember, normally we don't see MI in neonatal, in normal pediatric patient, but in general you can see MI in the patient if your patient is a case of Kawasaki disease, because Kawasaki disease is basically attacking the coronary artery, and coronary aneurysm the baby can have. So these are the important points for exam purpose that you should know. Again, a quick 1 minute break. I'm switching off the camera. You have exactly 1 minute, so I can't even switch off the camera. Yeah, so I'll give you 1 minute. Relax, take a deep breath, revise, and we'll start in 1 minute. Just have a quick break. पानी भर के आ जाओ मैं 1 सेकेंड. चलो भाई, लेट्स स्टार्ट. सो आई होप यू हैव टेकन द ब्रेक. लेट्स स्टार्ट अगेन. एंड वो एक शेर याद आता है ना, वो कहते हैं कि तुझे प्यार करना नहीं आता, मुझे प्यार के सिवा कुछ नहीं आता. तुझे प्यार करना नहीं आता, मुझे प्यार के सिवा कुछ नहीं आता. दुनिया में जीने के सिर्फ 2 ही तरीके हैं, एक तुझे नहीं आता और एक मुझे नहीं आता. सो लेट्स स्टार्ट अगेन. वेरी इंपॉर्टेंटली, येस, This is rapid revision only. So yes, so very importantly, I won't do it, I can do it, but by the end we have to get this. It's very torturing to fail for just 1 to 2 marks, and after 6 months whole preparation doing again. It's very torturing. I request everyone to please pay attention. बहुत प्रॉब्लम हो जाती है अगर आप थोड़े से रह गए ना, बहुत प्रॉब्लम हो जाती है, फील्स रियली बैड. सो आई रिक्वेस्ट एवरी वन प्लीज टू स्टार्ट स्टडिंग एंड स्टार्ट डूइंग थिंग्स इज रियली इंपॉर्टेंट. ओके, वन सेकेंड, आई सी द कॉमेंट्स. वन सेकेंड, कैसे देखते हैं? हाँ ठीक है. Okay ji, chalo, let's start again. What type of restraint is used in a child who has undergone cleft lip surgery? Yes, the baby who have gone a cleft lip surgery, I don't want the baby to touch his lips again and again. So I'm gonna do a restraint known as, very importantly, elbow restraint. If you look at this baby very carefully, this baby has got this cleft lip surgery done. So I don't want him to touch that thing again. So like this full straight like that, like a elbow restraint is something we are going to use. Next question. Newborn has a Apgar of 3 at 1 minute after birth. What should be the nurse immediate priority? So Apgar is 3. So when the Apgar is 0 to 3, that is known as severe birth asphyxia. Yes or no? If the Apgar is 0 to 3, that is known as severe birth asphyxia. Immediate breastfeeding? No. Begin immediate resuscitation. Transfer the newborn to the mother's chest, skin to skin contact? No. Perform full physical assessment. Physical assessment is done for every newborn baby. But naturally, for someone who is so sick right now, I would like to do immediate resuscitation with bag and mask ventilation. Mother reports that her 2-month-old baby has been crying excessively despite feeding and changing diapers. After feeding also, the baby is crying. What should be the nurse priority intervention? If I say, advise the mother to stop breastfeeding temporarily? No, you never stop the breastfeeding. Okay, you never ever stop the breastfeeding. Suggest the use of pacifier? No, in abroad countries we use pacifier, but here we don't use any pacifier like that, remember that. Okay, immediately administer sedatives. You don't want to make the baby sleep so suddenly. You never know if he has taken a foreign body inside, that's why he's crying or whatever. I would like to know this, assess the baby for pain, hunger and discomfort. Very good. Next question. The best preparation for tomorrow is doing your best today. You need to do the best today. Whatever right now coming into your brains, you have to remember, and you tell yourself, I remember everything. That's it. A child with thalassemia major is receiving deferoxamine. Why the thalassemia patient is receiving this deferoxamine? Because it is a iron chelator. Thalassemia means multiple blood transfusions. Multiple blood transfusions means iron overload will be there in the body, and this is a iron chelator. So the question is, which of the following should the nurse be most alert as a side effect? So remember, very importantly, ear. So desferoxamine or this iron chelator, they can cause ototoxicity. MCQ. The nurse is caring for a premature baby, 30 weeks of gestation. Which of the following intervention is a priority in the management of this infant? Now, the nurse is caring for a premature baby born at 30 weeks. If this baby was not born, if the mother was pregnant, then my answer would be give steroids. Okay, very importantly. Number two, now in this right now baby, the answer will be 30 weeker baby. So we all know that 28 to 32 weeker baby, we always kind of appreciate for the tube feeding, nasogastric feeding, orogastric feeding. So A is the best answer. Very importantly, yes my dear. If this mother was pregnant with the baby inside her who is 30 weeker, then definitely the answer would be steroids. 2-year-old toddler is seen playing alongside with other children but not directly interacting with them. You play yours, I'll play mine. That's it. This is known as parallel play. बच्चा अपना अपना खेल रहा है, दूसरा बच्चा अपना अपना खेल रहा है, known as parallel play. A neonate with chronic constipation undergoes a rectal examination, after which sudden gush of stool is there. You do a per rectum, You take out your finger and sudden gush of stool is there. That's a classical sign for Hirschsprung disease. Exactly. Very good. Very beautifully answering by Sukhniya, by Sri Lakshmi. We have Karan, Niharika, Bulbul, Komal, and again Neha Kumari. So Hirschsprung is the best answer for this question. While performing suctioning on a newborn, what is the sequence I should follow? So it is alphabetically M comes first, then the N. So suction the mouth first and then the nose, and you never suction the trachea. Which of the following is contraindication for administration DPT vaccine? Okay, if fever is there at previous vaccination, if fever is there, fever will always be there. That's not a contraindication to give DPT vaccine. Inconsolable cry, one of the side effect of DPT vaccine is a inconsolable cry. बच्चा बहुत रोता है, लेकिन वो contraindication नहीं है. The answer is history of encephalopathy within 7 days of the previous dose. अगर बच्चे को टीका लगाया और एक हफ्ते में उसको अगर दोहरे आ गए तो अगली बार DPT नहीं देना, आप DT दोगे. Next time you will not give DPT, you will give DT if the previous dose the baby got a seizure. Newborn is brought to the emergency department with complaints of drooling, choking, coughing during feeding. So choking while feeding, very straight away answer. Choking while feeding, I think we're talking about tracheoesophageal fistula. And what is the most commonest type of TEF? It is type C followed by type A. So CAD mnemonic, type C is the most commonest type followed by type A, and the least common is type D. So what do you think is the answer for this question? Any idea? A pediatrician prescribes oxygen therapy to a child with heart failure. When will you give oxygen support to this child? So when will you give oxygen support? During sleep? Like obviously every time you should give oxygen support, but ज़्यादा ज़रूरत कब पड़ेगा? During the sample collection for electrolyte imbalance. If you prick a baby, he will start crying, and that time you need oxygen. When the mother is holding the child, why do you want oxygen? During diaper change, sleep. But best answer will be naturally any invasive procedures done on the baby. I would like to give oxygen to the baby. The weight for height of minus 2.9 SD indicates what? So weight for height. So weight for height less than -3 standard deviation is severe acute malnutrition. So right now, see, less than -3 is nothing but SAM, severe acute malnutrition, but -3 to -2 is known as MAM. There is something known as SAM and something known as MAM. SAM is severe acute malnutrition, where the weight for height is less than -3 standard deviation, and MAM is moderate acute malnutrition, where the weight for height will be between -3 and -2. So that's why moderate wasting is the best answer. 10-month-old baby, moderate dehydration, admitted in pediatric type unit. What will you do? So moderate dehydration, we all know we give basically ORS at the rate of 75 ml per kg. So ORS at the rate of 75 ml per kg, straight answer that you should know. Okay. Next question, which of the following is not a major criteria for rheumatic fever? Rheumatic fever, we all know that the patient will have carditis, the patient will have polyarthritis, the patient will have erythema marginatum, the patient will have erythema marginatum, the patient will have subcutaneous nodules and Sydenham's chorea. So automatically arthralgia, very closest best answer. If I choose arthralgia and arthritis, definitely arthralgia is not a major criteria for the acute rheumatic fever. Motivation. Has everyone understood? Yes or yes? We have to clear this exam. Your parents have really supported you. Your parents have paid lot of money. You better buy a BMW, do something with your life. What are you doing? Just time pass will not work. You need to do something. Please remember that. ओके एक शेर सुनाते हैं, एक शेर सुनाऊँ. वो कौन सा था? तुम्हारी अगर एक बड़ा अच्छा था. हाँ, तुम्हारी अगर गलतियों के हिसाब होते, तुम्हारी अगर गलतियों के हिसाब होते तो सोचो कितने फसाद होते. दिल अगर बेनकाब होते तो सोचो कितने फसाद होते. किसी के दिल में क्या छुपा है ये तो रब ही जानता है. किसी के दिल में क्या छुपा है ये तो रब ही जानता है. हम अगर सच में ख़राब होते तो सोचो कितने फसाद होते. A toddler consistently refuses when asked by his or her mother to put toys away after playing, often saying no. When the child हर बात में बच्चा ना 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 no 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 he do, that is known as negativism. That is known as negativism when he say no to everything. What dietary modification is often recommended for GERD, gastroesophageal reflux disease? In Hindi if I say, हमेशा हम बच्चे को माँ को बोलते हैं कि आप ना बहुत ज़्यादा पतला खाना मत बनाना, पतला खाना रीगर्ड्स ज़्यादा जल्दी मार देगा, अगर आप थिक कंसिस्टेंसी वाला खाना बनाएंगे तो रीगर्ड्स कम मारेगा. So we always tell the mother to give some feed which is not very very watery. It should be little semi solid thick consistency, because the chances of GERD becomes less if you're giving a little thick consistency of the food. Okay. A nurse is caring for an infant described as extreme cry baby. This baby is very very crying. What is the primary nursing intention? Give sedation. बच्चे को हर बात पे सुलाना नहीं है. You're not supposed to make the baby sleep for everything. Okay. Restrict parental visits to to minimize the stimulation. No, the baby is crying so badly you want parents. Encourage parents to leave the baby alone. No, I don't do that. Identify and address the cause of the crying. Wide pulse pressure is the seen in where we have done that. We in a very importantly, where do you see wide pulse pressure? PDA. In a case of patent ductus arteriosus, you see a wide pulse pressure. And very quickly, if I ask you PDA किसके बीच में होता है? PDA is between what and what? So very importantly, this side we have pulmonary artery and this side we have aorta, and between them it is the patent ductus arteriosus, which is present between the pulmonary artery and descending aorta. Which of the following, now match the following, okay? वॉट हैपन्स इन बेबिन्स्की, बच्चे के पैर को छुएंगे तो बच्चा पैर को ऐसे खोलेगा. इफ़ आई बेसिकली टच द बेबीज सोल, बिग टो डोर्सी फ्लेक्शन, फैनिंग ऑफ द अदर टोज, लाइक ऐसा करेगा. ठीक है. द बेबी टर्न हेड टुवर्ड्स द सोर्स ऑफ स्टिमुलेशन, ओपन द माउथ एंड फीड, दैट इज नोन एज रूटिंग रिफ्लेक्स. रूटिंग, द मदर टच हर निप्पल टू द बेबीज चीक्स, ही ट्राई टू टर्न हिज हेड एंड रूट फॉर इट, like that. Okay. And abduction at shoulder and extension at the elbow. So once you suspend the baby, abduction at the shoulder and extension at the elbow, that is the muru reflex. So these are the important points you should know. The bone marrow aspiration in a child is performed in which position for posterior superior iliac crest? Yes, exactly. For PSIS, posterior superior iliac crest, if I have to do a bone marrow, I would like to keep the baby in this position. It's a very nice position. Very importantly, what do you call this position? This position is known as lateral decubitus position, because सारा का सारा ना bone marrow यहाँ से over here. So to the posterior superior iliac spine, well, drill it and I'll take it. So that's what. A newborn is suffering from brachial plexus injury. Which of the following will be affected? Brachial plexus, so this part is affected. So heart rate, respiratory rate and all that. I think upper limb movement, if I suspend the baby, if I have a brachial plexus injury, my upper limb movement will be restricted. Yes or no? So that's very simple. Yes, that finishes this class. Has everyone understood this much? Yes or yes? Please let me know in the comment section. Thank you so much. ज़िंदगी भगवान की एक बहुत महंगी गिफ्ट है. बहुत खुश हो के जिए, अच्छे से जिए. बेस्ट ऑफ लक टू एवरीवन, ऑल दी वेरी बेस्ट. गॉड हैज़ बीन सो काइंड. आई होप you have learned something and life is really beautiful. And before leaving we always have a song, so let's have a song quickly. कुछ तुम सोचो, कुछ हम सोचें, फिर खुशी का मौसम आए. तन्हा तन्हा कौन जिया है, रह के तन्हा दिल घबराए. आजा मिल के रिश्ता ये जोड़ें, शर्त बदल के सपनों को मोड़ें. इससे पहले कि ये दुनिया हमें आजमाए. हो कुछ तुम सोचो, कुछ हम सोचें, फिर खुशी का मौसम आए. Thank you so much everyone. Please take care. Life is beautiful. Keep shining bright. Keep rocking. Everything is fine. Believe in yourself. And before the paper, before any day in your life, deep inspiration and deep aspiration. Remember that. Okay. So please take care and